Welcome to the MPFT Podcast. Now we know that the experiences of patients, carers and families are really important. Their voices should help guide how we lead, how we work and how we make decisions every day. And we want the people who use our services, our staff and community partners to work together equally to help improve what we do. This year, MPFT launched its co-production, lived experience and community voice strategy, also known as our CLEVES strategy, to lay out how we will embed these areas of focus over the next 5 years and how we'll make our services better for everyone. On today's episode, colleagues from our Children and Families Care Group sit down with Louise, a senior peer co-production and involvement facilitator, who leads a great conversation about how this work is already taking shape across the Trust. Louise is joined by Tori from our Children and Young People's Mental Health Participation team and Dave from our Children's Diabetes team, who both bring some fantastic examples on how they are embedding the ambitions of the strategy into their everyday roles and the people they work with. We really hope you enjoy the episode.
Thank you both for joining me today. So we're going to be talking about some real life examples of co-production and involvement within your services. Tori, do you want to go first?
I think a really good example of co-production that we've been able to do here in the participation team has been one where we've collaborated with partners from across the county. So it's us in South Staffordshire, there's also North Staffordshire involved and also areas in Shropshire. And it's a completely new pathway to help children who present with quite complex symptoms and behaviours. And the idea is to create a brand new service for them right from the ground up, with children, young people and families involved and having their say on how they think the service should look, what it should be called, what it should involve, and really being able to be there right from the very conception of the service to shape it exactly how it's needed.
Thanks, Tori. I think it's more meaningful as well when people are involved right from the very start in anything to do with co-production. I think it's really valuable when people are included right from the get-go.
Yeah, I think they've really appreciated being brought into the project. I think we were quite nervous as professionals. You always feel a little bit like we're turning up to these people with nothing but a blank piece of paper and asking them what it is we should write on it. But actually the young people found that really quite sort of empowering for themselves. They felt very much like they were in charge and they were really kind of governing the direction that the service would take, which I think made them feel a lot more enthusiastic about it and a lot more sort of prepared to see a good outcome from it, as they felt like it would be just far better suited to the needs of young people than one where sort of people like my own age have come in and decided for them. They've actually been able to really kind of state their claim and say what's important to them and what they think is the most relevant to the young people who will be using it.
Absolutely. I think there's nothing better than listening to the experts. They are experts by experience. Dave, have you got an example you'd like to share?
Yeah, so youth workers are often referred to as professional friends. So some days it feels like I go to work and conversations is what I do, but particularly with young people, particularly evenings, weekends and holidays, finding out a lot more about them, leading us to finding out about kind of their voice, certainly their lived experiences, and what it is that we can help them to try and achieve in the future. The other strand for me was that coming into this role, I'd never worked in diabetes previously, so I'm certainly far from being an expert, and so speaking to the young people and their families and learning a lot more about diagnosis stories, for example, and being in quite a privileged position to learn and understand a lot more. I remember listening to a couple chatting and it reminded me, I don't know if you remember the scene in the film Jaws where they'd gone out to sea and there was the fisherman and the scientist and they were comparing scars from...
Yeah.
And it felt a little bit like that, but just a real privilege to be in that position to find out about young people's lives and experiences and kind of how we can help them moving forwards. I had a conversation with a young person who talked about being stopped and searched outside a football stadium because their diabetes pump was on show and the wires were hanging down and they were stopped by the police. Fast forward a couple of months later and we were taking a group to a football game and I contacted the club to just say, can we try and make sure that these young people can get in the stadium in as straightforward a way as possible and without any embarrassment, which then led to the club saying, well actually we've got an accessibility passport scheme that we're trying to launch, where we want to make sure that all spectators with any kind of disability can have a fantastic match day experiences, and would your group like to be the guinea pigs for that project?
Oh, wow.
So we did that, and we got into the stadium. To be honest, we were a little bit disappointed that we weren't stopped and searched and able to show off the passport. But what we were then able to do is give them a lot more feedback than they'd asked for originally around food stalls and young people with diabetes needing to be able to count the carbs, and also around a private space being available for if they were giving insulin injections. So we never quite know where those conversations are going to end up. And like I said, being that professional friend, my colleague does like to wind up some of the nurses in the team referring to us as the fun guys, because it feels as though at times we're the ones that are going off, and we'll do a youth group on a Monday night, we'll be at the gym on a Thursday. Last week we took a group to Alton Towers, but that does put us in this really privileged position where the conversations we have with the young people are so rich, and we get to learn so much about their experiences, their voice, and what we can help them trying to change going forwards.
That's amazing, and I can imagine the impact of having the passport at the football stadium was huge to all of those young people, that they don't have to feel, embarrassed going into a stadium. So that's brilliant.
Absolutely, and I mean, I'm convinced that we're not just going to stop there. That's the sort of thing that all sports clubs, music events, entertainment venues should have something similar. So we've still got a lot more to do to change the world. And I do keep going back to the young man who first shared the story, just to say, do you know what you've done? And he initially got no idea because he supports a different club anyway. So I did try and get him to go back, and just he'd have to cover up his club shirt to go and visit, but he wasn't having that.
Yeah, and it's just incredible that the amount of difference that will make to so many people just by you've heard that story. And made a change, which is fantastic, and hopefully, like you say, other clubs and music venues will follow suit.
That's it, and again, it's one that when we first meet with individuals, I met with a young person for the first time last night who was newly diagnosed, feeling kind of quite isolated, no friends, lack of understanding around diabetes, and again, it's very much a case of sitting, having conversations. What do they like? What do they want to do? Here are some options in terms of how we can support you, whether that's on a one-to-one basis, whether that's come along and make some friends in the group, and kind of trying to pitch where they are at the moment and how we can best support them in future.
That's fantastic. I think it's what's really good for people is the peer-to-peer support. So having peers and other people that are going through the same thing, having them around, it's fantastic.
Well, recently we've been going again. Not all young people want to engage with some of the activities that we do, so we looked at setting up a support group in a local high school. So we've been in there for about 12 months, and we'd go in and we'd have some lovely conversations with them, but it didn't feel like it was really going anywhere. So we sat down with them at the start of the year and said, look, what is it that you want from us? Is there anything that you want to achieve? So we started to talk about kind of their daily lives and how diabetes affects them in the learning. Some of them were saying they were getting into trouble for turning up on time at school but not ready to learn. And then when we unpicked that their alarms had gone off 8 times in the night. I can only liken it to when I was a new dad. And for me, they'd done well to be in class at 9 o'clock in the morning, never mind being ready to learn. So again, we kind of worked with them, and they put together a PowerPoint presentation that they recently delivered to some of the education staff in the school, pitching some of these kind of practical things that affect them on a daily basis. Giving 1,400 injections every year. If they're having good days, could be way more than that. So they very much kind of did a little bit of education. They talked to the school about what it was they were doing well to support them at the minute, and then also about what they would like the school to do more. Now, what we're hoping from that, there was lots of positive discussions around next steps and future developments. So again, we're certainly hoping that will pay off and be a template that we can then hopefully roll out across lots of other schools as well.
We've heard some really good examples there of co-production and hearing the lived experience voice. Would you have any advice for members of staff, members of MPFT who would like to use co-production methodologies in their work?
I think that one of the things I think is most important is just be brave enough to have a go. It's the sort of thing where there will be challenges that you've never even considered before that will come up through the course of doing it, but you will have an amazing time, and you will be able to be secure in the knowledge that you're creating something better because you're making sure it's fit for the people who will use it. I know in our team, one of the things that we've found has been a brilliant way to just let people have some interaction with the points of view of lived experience is through the Whose Shoes game. We call it a co-production tool disguised as a board game, and you get scenario cards, and each of the cards is something that's been said or experienced or related to us by a real person going through those experiences themselves or in their family, and being able to really kind of read and share what people have been willing to tell us about their experiences. We've got sort of like experiences of mental health services, experiences of perinatal and maternity services. So there's quite a wide range of different viewpoints there, and it really is a great way to just hear what other people think and to, as the name of the game suggests, put yourselves in someone else's shoes for a while. So if as a team you've never come across that before, that's definitely an area I'd suggest looking into if you wanted to kind of dip your toe into the lived experience and co-production world.
There's always something for me around how young people friendly professionals are. For us working with teenagers, it's a lot about, remember what it was like as a teenager. Remember the bad hair, the bad relationships, the bad clothes. There's a lot going on. And from our perspective, throwing a long-term medical condition as well, 1,400 injections every year, 8 alarms going off through the night. It's not fun. No one would choose that. And so again, recognising what's going on, and that there's a lot more going on than just a medical condition. Mm-hmm. And again, I think it's being open to have those conversations. It's about being open to how young people friendly am I? Am I warm and welcoming and engaging? Is the building itself warm, welcoming? Is it somewhere I'd want to go as a teenager? Is that someone I'd want to speak to if I was a young person? But again, I think ultimately it's about that journey and the making that difference. Young people feeling listened to, and you'll have a fantastic journey. It won't be a straight line, it won't be easy, but it will be really interesting, good fun along the way, and the end result for young people will be absolutely amazing.
Yeah, brilliant, thank you. And I think you've both touched on it by saying that it is a journey, and co-production is a journey. It can be long, there can be delays, but it's really worth it to sort of get that impact for children and young people and their families and carers as well.
I think you're right. I think it's all about kind of giving people that opportunity to have the power for themselves and to be able to say, this is the way I think this should go, and I think this because of what I'd experienced when I was going through this. And I think it gives people that real sort of sense of, I can actually make a difference here. I can stand up and I can say, perhaps this wasn't something that was good enough for me, and I don't want someone else to go through it. And I think it's a real thing in terms of, like, from the point of view of mental health recovery, that's a huge thing to be able to say to yourself, I've made a real difference in the world and the spheres that I move in. To be able to say, just because somebody listened to me, someone else is going to have a better experience. It just shows the power that it's got to have a real impact in how we work and what we deliver to our communities.
And thank you to Louise, Tori and Dave, and thanks to you, the listener, for joining us on this episode of the MPFT Podcast. Please check out our YouTube channel where you can watch video versions of our podcast conversations or find the audio versions on your platform of choice. Thank you for listening, and we'll see you next time.